this is Dr. Kyle with ICE Clinics bringing you your next tip for Tuesday. What I wanted to discuss today is kind of diving into the depths of what is our core, what makes up the core, and how we get it to work properly. I think a lot of people have the misconception that the core is just your abs, maybe the thought that I just need to go do more sit-ups or more crunches. But in reality, that kind of dated mentality leads to a lot of core imbalances, which I think sets us up for a lot of aches and pains, especially in the low back. One major thing to understand about the core, if you can simply think of it in terms of being kind of like a cylinder, so kind of around our entire torso, we have our front, we have our side, we have our back, but we also have a top and a bottom to that cylinder. So top would be our diaphragm, and then bottom would be pelvic floor. So when someone says to engage your core, you need to make sure you're not just flexing your abs, but that you're trying to sync up all of those regions kind of firing at once. Because ideally what we're trying to do is tighten the entire portion of that cylinder, front, top, back, and sides. So I'll give you kind of a few tips that you can run away with today to get a better understanding of how to do that in your everyday life. And much like you've learned with our tagline here at ICE Clinics, we're all about intent. Health with intent is kind of our tagline. So having intention with how you engage your core can really be the best exercise you do as you go throughout your day, and try and build on that as a foundation. So one thing to consider with our abdomen is we essentially have two major muscles that make up the front part. One goes up and down. That's typically the six-pack muscle that everybody talks about, called your rectus. And then you have what's called a transverse abdominis. That would be essentially like a corset muscle that goes from side to side. In my mind, that's typically the one that is under firing most of the time, but keep that in mind because we'll come back to that in one sec. I think the back, people end up overusing their back when they're trying to engage their core, so that's not necessarily something I'm worried about you learning how to re-engage. When I mentioned the diaphragm up top, that has more to do with the rhythm of your breathing when you go to do a movement that requires your core to engage, which is almost all movements. And then last but not least, pelvic floor is a very big one as well that we'll talk about, which would be kind of the bottom side of that cylinder. So as far as a good way to picture getting that transverse abdominis to engage, what we're looking to do, and you can start practicing while you're on your back, just get into a relaxed position like this. And I want you to practice on kind of clamping down your ribs to where there's a smoothness here in your abdomen. So you don't want to see any flaring of your rib cage like this. Because ideally, when I go to get up off the table, if that rib is flattened, that'll set me up for success. Whereas if I start from this arched position and I try and get up, I'm already setting myself up for a recipe of failure. So smooth out that rib cage, and then what I want you to do is practice on sucking your belly button to your spine. This is a very practical way of getting everything to kind of sync up on the front side. From that point, you should feel nice engagement here, no flaring. This is where you should be able to sit up a little smoother and a little more coordinated. And I think that goes a long way as far as protecting ourselves when we go to transition out of motion. So that's an example of me sitting up. But that same thing holds true if I'm getting out of a chair, if I'm getting in and out of my car. I need to make that right synchronicity of motion first. So flattening the ribs, sucking in the belly button. As far as the breathing is concerned, I think when you hear people exert themselves a lot, they're typically grunting, right? Ugh. So that's kind of the instinctive way for us to bear down and properly engage more muscles around our core. So when you go to get up out of a chair, or when you're lifting something off the ground, along with those first two principles, if you kind of bear down and push with your breath, that will help to sync up that top portion. As far as your pelvic floor, that bottom side, if you can picture going to the bathroom and then stopping midstream, that sensation of you kind of lifting up, that's kind of engaging your pelvic floor. So one of the best exercises I'm aware of for pelvic floor, along with those same principles we just mentioned, is doing a deep squat. So going down really deep, and then from this angle when you go to push off, getting that lifting in your pelvic floor, making the grunt feeling, and then keeping your abs tight allows you to do that in a much more safe and predictable environment. And that's a really good way to kind of train up all of your core firing at once. One other real easy tip that we give to people that are suffering with chronic low back pain and have an imbalance with their core, when your inside muscles of your legs engage, it typically forces you to use your core in a better synced up motion. So when you're getting out of a chair, say you're somebody with chronic low back pain and you're getting out of a chair, one of the best things you can do is make fists and then squeeze your legs into the fists as you go to push yourself up out of the chair. Again, just a really easy way to kind of get everything to fire in unison. But I think that could prevent a lot of further injury over the course of time. I know it's a really long video, but this is a concept I think is very important towards spinal health and is something that we see very regularly in our clinic that I think people have a little bit of an altered understanding of how it should be. So I'm hoping you keep these tips in mind, hoping they help save a few backs out there. If you have any more questions, don't hesitate to reach out to us. Again, my name is Dr. Kyle with Ice Clinics. Thanks for watching.